Told to join a national mission to help beat Omicron. Today, hundreds of thousands did just that. From Brighton to Belfast, they queued at vaccine centres desperate to get a booster. They snaked across Westminster Bridge in London, stood for hours in Glasgow, and even got turned away in Oxfordshire.
She said they got plenty of room, and then I get down here and then I got told I can't get my jab because they're not doing any more walk-ins.
But it wasn't just walk-in centres that were overwhelmed today. The whole booking system crashed at times and free lateral flow tests were unavailable online.
The website clearly was too busy based on last night, but actually we just took a bit of a chance.
This is your booster, is it? Did you have 2 Astras?
The Prime Minister's appeal last night for every adult to get an extra shot before the end of the month has had an effect. Visiting a vaccine centre in West London, he gave a sombre update of why we can't be complacent.
Sadly, yes, Omicron is producing hospitalisations, and sadly at least one patient has now been confirmed to have died with Omicron. So I think the idea that this is somehow a milder version of the virus, I think that's something we need to set on one side.
In his own address to the nation,
good evening,
the leader of the opposition questioned the timing of the booster surge.
A booster for every adult before the end of the month is a big challenge, which is why we argued that the government should have stepped up sooner. But time and time again, the British people have risen to the challenge. So let's pull together now and do the right thing once more.
To meet the government's new target, the NHS will have to deliver around 1 million doses every day. They've only ever given just over 550,000 boosters in one day, and the record for daily vaccines is 844,000. In order to succeed, opening times at vaccination sites will be extended, 750 military personnel will help out, and NHS staff will be retasked and non-urgent appointments postponed.
The government fully acknowledges that there will now be limited access to GPs and other healthcare services for patients, but their logic is that it could be far worse for the NHS in the long run unless this booster programme is accelerated to this sort of scale.
Whatever the reasons, Dr. Hussain told me she is going to have to cancel appointments.
I have to be honest, if right now, you need your asthma review and you're just on salbutamol, we wouldn't be calling you in for your annual review, which we normally would have done before.
So will that compromise patient care?
I would like to think no, but I don't think I've ever had to think so hard about prioritising care.
By early evening, queues at vaccine sites appeared even longer. 3 doses will be required for all COVID passes soon. Another sign, perhaps, of how crucial the booster will be.